faced with highly labor-intensive goods, you've got a choice. People really need medicine and education. You can't have a decent, modern, middle-class life without them. And you could try to put pressure on those fields to find innovative ways to drive down costs, but every consumer's cost is also somebody else's income. And the people who get that income have every reason to organize to protect themselves from innovations that put pressure on them. And those people are part of political coalitions. And increasingly, as a result of political polarization, that coalition of those providers of those goods is the Democratic Party. So cost disease is not, as Baumol argued, just a natural outcome of a free market. It's an institutional feature of a regulated, politically embedded economy. And you can push the metaphor even further and note that housing in fast-growing places is not inherently supply constrained. We have lots of air and steel frame buildings and elevators available to us, but you get constantly spiraling costs because that air and steel frames and elevators are prevented by regulation from responding to price signals. So cost disease is institutional. So the alternative to driving down costs is subsidizing prices. And this is the socialism part of the story. If people are facing punishing prices of education or medical care or housing, they're not going to take it. They're going to yell and they're going to scream and they're going to ask for relief. But if that relief cannot be delivered through changing underlying costs, it'll happen through political pressure to subsidize prices. And the Democrats are increasingly the party of subsidize. My party, I should just note, just in case anyone's wondering, are increasingly the party of subsidizing prices, while in some cases actively encouraging higher costs. For example, in the regulations in the Build Back Better law around childcare that we may get to later. So the final point is to get to the deficit point, which is one of the things I think we'll get into later. If you have this dynamic, you have a long-term prescription for more and more cost eventually appearing on the government's books. And this is where you get to the limits of old school deficit reduction. Just trying to put your finger in the dam by capping how much the government will spend on these various goods won't work, because people can't afford to have them end up on their family budget instead. And so you've got a long-term financing problem, and budgetary mechanisms can't get at the underlying driver, and that driver is regulatory.
So Steve, can we actually unpack that a little bit? How, and you touched on it on budget deficits, but can you talk a little bit about how it relates to the politics around budget deficits, both kind of past, looking retrospectively, and then forward looking?
Yeah, so if you look at a lot of the, not just the things in the past that have been going up, but the things where there's political pressure to get those goods onto the government's books, and we're going to go into more detail about this later, almost all of those are in inherently supply constrained areas, right? So the deficit problem of the past, but also of the future, right, that looms the largest is healthcare. Healthcare is full of supply constraints all over it, and we've got numerous senior fellows and people at the Scannon who've dealt with this, Ed Dolan and others, right? And so that, and the problem, of course, with that is just trying to cap costs doesn't work, because if what happens is all those costs ends up as co-pays and deductibles and everything else, then people who don't have very highly increasing incomes can't deal with it, and the political pressure to get it back on the government's books is irrepressible. All of the problems we're facing in the future, right, also have the same dynamic, right? And we talked about this a little bit, but if you look at all the proposals in the Democratic primary, they were all about people facing rents they can't afford, people facing education that they can't afford, people facing university costs that they can't afford, right? All of those are the deficit problem of the future, right? Those are the things that eventually there will be irrepressible political pressure to put onto the government's books, thereby exacerbating our financing problems. And unless we get at the underlying regulatory drivers of them, which are not accessible through normal deficit reduction kind of means, then the problem is going to be unsolvable.
So Steve, it sounds to me like a layperson like me, that this is kind of a shell game of costs. So, and you kind of referenced this in the lead up to the 2020 election and some of the political posturing that we heard. how do these problems relate to inequality?
Yeah, so this gets back to the point that every individual's price is somebody else's income. And a large number of the providers of the services and goods we're talking about are quite affluent. Cost disease, as we're describing it, is mostly an upward redistributing process. Most patients, for example, are less affluent than doctors. And there's an increasing interest in the left in what they call pre-distribution, looking at how inequality is generated before we get to the process of taxing and spending. And as Brink Lindsay and I argued in The Captured Economy, available in all better bookstores, a huge amount of inequality operates through a regulatory channel in which the organized affluent can use the state to artificially constrain supply. So the argument to the left we make is twofold. First, cost disease socialism doesn't work. If you push more money into a field characterized by constrained supply, the main effect will be to further push up prices, which will then lead you to have to inject even further subsidy, which will then push up prices ad nauseum. You have to get to the cause of the cost rather than simply addressing the price. Second, trying to solve the problem in this way leads to the capture of even greater rents by the affluent. If, for example, you subsidize the cost of housing in a highly constrained city like San Francisco, the people who will capture most of the subsidy are landlords. You could then try and solve the problem by artificially limiting the price they can charge. Well, that'll rebound on you by making the cost problem even worse because it'll lead to further constrained supply, at least in the cost controlled part of the market, which is generally the one that less affluent people will operate in. So our argument is, to the left, is that they need a deregulatory, or in some cases, other kind of institutional mechanisms, as well as a redistributive agenda, right? A purely redistributive form of the left is not going to work. And that redistributive arm is best if, like the child tax credit, it's not targeted on particular goods where it will only end up inflating costs. And so that, I think, is the story we want to tell about inequality, that the redistributive part you want to do through the most generic forms of redistribution you can, while simultaneously going at these underlying drivers of spiraling costs that generally end up in the pocket of the relatively affluent.
Well, thank you, Steve, and thank you for setting the table for the rest of this discussion. I'm going to pivot now to Sam, and since we're talking about the Democratic agenda currently, and Build Back Better is all over the news, Sam, can you unpack how the child care provisions in the Build Back Better proposal relate to the problems that you three identify in this paper?
Yeah, I'd be happy to, Kodiak. Thanks for the question. The way I like to think about this is that the traditional socialist cry to socialize the means of production has shifted into something more like subsidize my cost of living. And childcare is a perfect case study of this, right? Going to Steve's points about producer interest and upward redistribution, the cost of childcare in the United States is highly variable where you live. Infant care in Brooklyn can be $20,000 a year. And the median price of childcare in Mississippi is something like $5,500 a year. So it's a fourfold difference. And when you simply subsidize particular goods and services, in the case of childcare, for example, you're not only subsidizing particular producers, in this case, accredited childcare providers, but also subsidizing relatively affluent people who are able to live in places with higher cost of living that have more intrinsic demand, in part because they have more amenities. And, if you could remove the cost calculation for rent, childcare, and these other factors, why wouldn't you want to live in San Francisco or New York relative to an up and coming city, right? And so there's a twin problem here where it's not just that the childcare subsidies, but housing subsidies and so forth are redistributing upward. It also removes some of the structural forces pushing for reform. In the case of housing, for instance, if you had a renter's tax credit of the type proposed recently by Senator Wyden in the Dash Act, what would be the motivation to what would be the pressure on cities and local jurisdictions to reform their housing laws if anyone has their rent capped at 30% of their income, right? And in the case of childcare, the it gets a little more complex, because not only are they subsidizing the front end of childcare, capping costs at around 7% of income or less, depending on your income level, but they're also bringing in mandated pay increases by requiring providers to meet federally standardized quality regulations and to pay their workers on par with local kindergarten and public school teachers. Now, the immediate consequence of that is obviously going to be to raise costs. You can't both raise wages for childcare workers and reduce the cost of childcare, because labor and rent are the two biggest factors in childcare. But what you can do is cover up those costs on the front end by subsidizing the consumer side. And so what they've proposed doing is essentially using tax credits to cap the amount of the exposure to those childcare costs that households will face. Importantly, they're not making this universal. This is means tested. So anyone who's outside of the subsidy range will experience a pretty dramatic increase in their childcare costs. At the same time, because government tends to direct subsidies to things that are legible, things that you can actually measure and put a name on, there will be an enormous bias in these childcare subsidies against home and family-based models of childcare, which tend to be more informal. And by being informal, it means it's difficult for those providers to actually get access to these subsidies, much less meet all the various barriers to entry that are being imposed through these quality standards. And this is ignited in the last week or two with the realization that the provisions in this childcare proposal include, pretty explicit barring of federal funding for daycares and childcare provided in a religious context. And so faith-based organizations, including the proverbial church basement, are understandably up in arms. But I would say even someone who's relatively secular should be a little concerned about this, because we live in a very diverse and pluralistic society, and we need to accommodate that in our federal policy. That's especially true in childcare, where the formal sector, the paid center-based childcare, is often the most expensive and the least preferred by families with children. Across surveys, you find the only cohort that has strong preferences for external professional childcare are the college educated, particularly in dual earner families, which are a minority of American households. And so what we see here is both an elite policy preference being imposed from the top down, but also one which is designed intentionally to benefit a particular interest group, which represents a Democratic Party constituency. So this is sort of both sides of the regulatory capture rearing its ugly head. Obviously, longer run, it doesn't do anything to address the real sources of childcare cost disease, and if anything, it undermines it by again crowding out those home and informal based models, which will probably be the solution in the long run, especially as remote work and so forth have blown up the traditional model of childcare.
Thanks, Sam, and you're absolutely right. I think the remote work is having rippling effects across all sorts of different sectors. So I'm going to pivot now to Daniel. Daniel, Sam covered the kind of childcare provisions in Build Back Better and touched on housing costs as well. Can you give us some other examples of cost disease in Build Back Better or other policy proposals like it?
Yeah, so in Build Back Better, it does touch, excuse me, on some housing supply issues, both as it relates to direct support for renters and in provisions to increase housing production more broadly. And I think Sam and Steve have done a good job explaining why the purely demand side approach that we see with rental support and everything like that, even though it may be necessary if we had a far more elastic market where housing supply can respond to increases in demand, it's a worthwhile idea in lots of jurisdictions, especially high growth jurisdictions in coastal cities. It's to a certain degree throwing good money after bad, where we have more of these rental subsidies or cash for those who don't necessarily qualify, going after a relatively fixed number of housing units. And of course, this is to the benefit of those who own the properties. You also have the added effect, and this is sort of analogous to what Sam was talking about in childcare, where you create incentives to only find for the market to move in certain directions that may, to a certain degree, be contrary to the choice of others. So when to the choice of what a large number of people would want, or at least constraining the choice beyond what the market would provide. So when you have a constrained supply in a housing market, when you have then landlords are faced with only one option of what they want to do with their capital, which is to make their homes nicer and provide them with amenities and everything like that. And there's nothing particularly wrong with that. But if the goal is to increase housing opportunity, make it so people can live closer to work and make public transit more appealing as an option, which will help with their finances, there needs to be as well a focus on just getting more people into a given area, which, thanks to the elevator, is definitely possible. So when you make it so there are only so many housing units can be built, that funnels capital really into only one direction, which is to make things nicer and tonier. Whereas if you allow for an elastic housing market, a landlord can still choose to make their row home positively Fraserian in terms of the layout and the design and everything like that. But that comes at the cost of making it into, say, a quadplex or something like that, or selling out to someone who wants to build a taller apartment building, selling out in the best way possible. So there's that side of the equation. But you also see cost disease problems when we're talking about direct public financing of new housing projects. And this really runs into the deficit, and debt problems, where due to local regulations, these jobs are not nearly as shovel ready as we would want them to be for effective stimulus more broadly, if we're talking about that issue in particular, but also in terms of making the dollars dedicated to housing go further. You have these projects which are mired in red tape that get stuck in court for God knows how many years, and that just and that get whittled down in terms of the number of housing options which are that are available. So you really see a problem both in the things government wants to directly do, as well on top of the perverse incentives that purely demand side solutions that more directly help consumers run into.
Our panelists have done a fantastic job of really setting the table for this discussion. And so I'm going to dig in a little bit more to get to the broader aspects of the paper. So to all three of you, would you talk about some of the other cases that you highlight in this paper, and how do they relate to this cost disease problem that you so thoroughly outlined?
I could touch on healthcare, for instance, and I encourage anyone in the audience to add some questions to the Q&A for later. But healthcare is a classic case of cost disease. The U.S. spends double what most other industrial countries do as a percent of GDP on healthcare. You can attribute some of that to the fact that we're wealthy. America is, 20-30% richer than the United Kingdom, for example. And there is genuinely a positive correlation between your wealth and how much you spend on healthcare. But that does not come close to accounting for why the U.S. is such an outlier in our healthcare spending. What does account for this are enormous constraints and barriers on the supply side that limit competition and limit the number of providers that we have, whether that's nurses, doctors, or hospitals. And these barriers to entry, for instance, 12 plus years of medical education to become a practicing physician, whereas in the rest of Europe, most of Europe, it's a 6-year medical program with interning and training built in. These kind of barriers were put there deliberately. My colleague Rob Orr has a very good essay called "The Planning of the Doctor Shortage," where he walks through how in the 1980s a regulatory commission created at what is now the Center for Medicaid Services and HHS warned of an impending doctor surplus, and that we had to take actions to curtail the supply of doctors, lest we, be overrun with physicians or something like that. And what that ended up doing is bringing in a moratorium on new medical school slots, big cuts in residency funding, and freezing a lot of the way we fund things in place in ways that have really distorted the allocation of the funding that we do have for things like residencies. And now, as a result, there was an enormous shift in the priority of healthcare away from general practice towards specialization. So more and more physicians moved away from primary care into specializations where they can earn more money, in part to pay down their enormous student debt. A typical doctor has over $200,000 in student debt. These are all byproducts of supply side restrictions, which in turn push up the cost of healthcare while reducing access. One of the few things in public health economics that actually correlates with public health outcomes is the supply of primary care providers. Having more plastic surgeons in your backyard does not necessarily correlate with good health, but having more doctors and nurses that are able to provide primary care does. And so if we want to get to universal coverage, and we should want that, and the Scanlon Center has made universal coverage a bedrock foundation of our social policy agenda, we need to also radically enhance the productivity and supply of healthcare providers and services. Otherwise, we're just going to get more people insured and chasing after the same number of doctors, same number of nurses, and same number of specialists that other countries don't seem to need. So
yeah, and can I just get in on that point really quickly, sure. Which is, I think it gets back to the question that Kodiak asked earlier, which is, if you were someone on the left in this conversation, right, one of the things that you'll notice is if you think that it's important to spread the cost of these goods generically across society, right, to share those costs rather than have them operate purely through individual private purchase. Every time the cost structure of these goods goes up, the degree of difficulty of socializing those costs goes up at the same time, right? And that, in some ways, you can think of that as the core of the story of the effort to get universal healthcare in the United States over the last few decades, right? That we keep going back and back and back, trying to figure out ways to effectively socialize these costs, while the ladder keeps getting higher and higher to do so, right? And so that's really what we describe as this endless, quite devastating cycle in any of these goods, that if you can't get control of the underlying costs, the challenge of effectively socializing the price gets even harder. And that's not just true of healthcare, it's true of every sector that we're talking about. And in fact, the subsidization makes the cost problem harder because it simply drives up those costs because there's more money facing the same number of goods. And so that's where I think what Sam is saying about healthcare is true generically across all of these areas. And that, I think, describes a lot of the reason why efforts on the left so often in these areas feel so frustrated. Because they're facing this basic dynamic that the strategy of simply socializing costs can't get at.
I think that's totally right. When Canada brought in single payer healthcare, there was a doctor strike, a nationwide doctor strike, and they eventually overcame that strike, obviously, because Canada still has single payer healthcare. But in many ways, there was a time to do Medicare for all, maybe in the 1950s, and we've kind of missed that period. And now we need to get to a point of much greater utilization of our healthcare resources that we already use to even make that viable, right? This has come up in the case of Democratic proposals for Medicare for all, where they move, once you get beyond the rhetoric, you start to realize, well, actually, all these blue states are going to lose out enormously if we had a national Medicare for all program, because we'd be shifting resources away from New York and Connecticut to Alabama and Texas, where they haven't even expanded Medicaid. So these are really intractable problems, and they only get more intractable if you don't address the supply side.
So Sam, one of the things that you mentioned when you were talking about healthcare was the cost of education for physicians, for doctors, and part of the reason why they're motivated to specialize is that paying back those student loans can be quite a hefty proposal. And I think that ties a little bit into what Steve jumped in to talk about too, that you can see this sector by sector. I know the paper talks about it. Do you want to unpack a little bit the crisis in the educational system and the kind of ever expanding cost?
Yeah, I mean, I can talk a little bit about healthcare and maybe pass it to Steve and get him in more trouble as an actual someone in the employ of a university. But in the case of medical school, it is standard across most of the industrial world, with the exception of Canada and the US, to have dedicated medical programs. Only in Canada and the US do you do a 4-year pre-med program. And part of the biases that creates in the US context are that Canada manages that by having like explicit quotas to ensure that they have an adequate supply of primary care physicians. We don't do any of that. So we have sort of the worst of both worlds, where we have a very long and lengthy and expensive pipeline to get into practice. And then once you're in practice, we have this sort of mixed system of public and private with next to zero coordination that leads to enormous misallocation of resources above and beyond how much we spend. So, there's a lot that you can do with 17% of GDP that we're missing out on. And this doesn't, big picture doesn't even necessarily require more spending to get to universal coverage. With the right reforms to scope of practice for nurse practitioners, occupational licensing more broadly to make mobility within the nursing sector more feasible, including across state lines. These things can dramatically enhance the productivity and the supply of healthcare while actually bringing down total national health expenditures. And when it comes to higher education more broadly, I'm thinking about this recent article in the Yale Daily News, which addresses Yale's administrator problem. They have one of the highest administration to student ratios in the country, but I don't want to pick on Yale. This is a problem that is affecting not just the Ivies, but across the board. The Ivies seem to be particularly bad because they have large endowments and they have to pay out fractions of those endowments, and they don't want to enhance their student bodies because growing the student body of Harvard or Yale or Princeton only dilutes the prestige that is entailed by going to those very exclusive schools. So instead, what they do is they build more amenities, more sports stadiums. They invest in deans, nested hierarchies of deans upon deans. And then part of this is also not just the shell game with having to spend some of this money, but also the way that we regulate higher education. So everything from review boards for scientific research to Title IX. These things have created more administrative burdens for the universities themselves, and to be in compliance with those regulations, they have to bring in more administrators that are really tangential to the mission of liberal education.
Well, Sam, having gone to Smith College, I'm a little wary of engaging in a debate about the value of Title IX. I feel like that might put me at cross purposes with my.
I'm not questioning its value. I'm saying that as these regulations have enhanced, there's more demand on universities for administration and managers to actually enforce compliance in these areas.
That makes sense. Steve, Dan, do you want to weigh in on education?
Yeah, I'll go in just briefly. I mean, I think the underlying point here, and I think the thing that's worth keeping in mind, is thinking about what we might talk about as the old deficit politics versus the new deficit politics, right? The old deficit politics was like you had the government's budget, right? And you could play those games that they used to get where, which one, which program do you want to cut, right? And the assumption was there was like a lever that was in the budget that you could go and grab, and you could push that lever and pull it down, right? But all those levers were available to the person playing that budget game, right? But when you actually look at the phenomenon, we're talking about the things that are both already driving costs and are going to drive costs in the future. They're all, fairly deep into the industrial structure of these various different occupations and fields. And what that means is there may not be that much similarity in the politics or the political coalitions when you're trying to deal with costs in medical care versus the costs in universities versus the cost in housing, right? Any of those places where you address those underlying industrial regulatory problems are all good from the point of view of deficit politics, right? Or long-term deficit politics, right? And so in the case of universities, I would just add a few things. When you compare the United States to the countries that we often compare ourselves to, social democracies, one thing you see in higher education is, for example, the utilization of space is just very different, right? They're using that space incredibly intensely, whereas the United States just uses that much less intensely. That has to do with fairly obscure features of the business model of how people become provosts and presidents in universities and their incentives to build versus to do other kinds of things, right? Regulatory compliance is one of those parts of the story, right? The Department of Education, regardless of what area we're talking about or what the particular merits of it, right? All those things that that we do, whether it's collecting data or putting on human subjects review or any of those things all end up translating into a thicker and thicker administrative crust in the university. And I'll just say, just to defend my own people, right? It's not, when you break this apart, it's not really the professors that are the source of the cost increases in universities. And I had to go into some of this literature, right? It's the fact we keep getting more and more administrators, and that's not for totally crazy reasons, right? There are reasons why there it is. Again, some of them are regulatory, some of them have to do with the way that we've structured competition between institutions. But trying to solve that problem, again, which is a business model problem of universities, is long-term deficit politics, right? And this is where, again, the thing I most want to get across is just how different the deficit and financing politics in the future will be from the politics we've seen in the past. It won't operate through trying to create big generic caps of various sorts, of the kind that you think of like Graham-Rudman-Hollings and that kind of device, right? The people who really care about this stuff are going to have to get way down into the guts of how we train doctors, right? How we organize competition between universities. This Daniel will be able to talk about, right? How we structure intellectual property, right? All of those questions are the financing questions of the future.
Yeah, there is, not to, obviously we talk a lot about regulatory policy, which deals with laws at the federal all the way down to the local, level, but we have to give the private sector a little bit of credit in their contribution to the problem, not just because they directly profit, either, through the money passing through them, or because you have a bureaucracy that is expanding to meet the needs of the expanding bureaucracy. But because there is a resistance to change, this is particularly a problem when you have institutions like universities, like the healthcare profession, like to a lesser extent, the legal profession, where it's not just, an assembly line thing, like, oh, well, if we tweak the way we weld these doors, we can increase our factory output by 2%. Where there is a non-economic goal, and there's absolutely value in having a certain dignity, a certain respect for the profession that is separate from the purely financial. But at the same time, that can make it the institution a lot more conservative, not necessarily politically conservative, but conservative in that it is resistant to change. It is resistant to experiment. That is the broader thing. No one likes being told, that this thing that they have a very special heart, for which they have a very special place in their heart, it's inefficient. It's time to trim some fat. That is offensive, and people, will get defensive being told that. But additionally, you have, generally speaking, and this is the nature of bureaucracies which have lawyers that are doing their job and keeping their clients out of legal risk, you have, in the case of universities, a hesitancy to experiment with both new journal subscription models and different ways in which libraries reproduce and redistribute the works they own, for fear of pushing the envelope of fair use only to be found in court that they're wrong and being on the hook in a big way for copyright infringement. So there's a potential legal liability. We see this also in the various regulations proliferated by the Department of Education, but also a general hesitancy, if we're talking about the economics of journal subscriptions more broadly, of saying, what if we experiment and what if we have a model where we're just going to fund an open access journal and other universities are going to follow if we set that trend. There's a hesitancy to experiment that is totally understandable because no one wants to be the first guy to jump on the barbed wire, but it creates a collective action problem that increases these costs, not necessarily through just the very familiar underutilization of resources, but also because of a failure to experiment and let markets do what is best in that regard.
This feels very on brand for Niskanen. We have spent the last 40 minutes outlining complex and thorny problems. But I also think part of what makes Niskanen tick is that we are solutions oriented. So now that we've kind of set this table, we've talked about these problems, we've talked about how interconnected they all are. Can we talk through some of the solutions? What do you think are better approaches to policy for some of the problems that we've outlined that would yield different outcomes that would kind of diminish the cost disease of socialism?
I can kick it off with some statements about the budget process itself, right? So, given our analysis around cost disease and this very prospective approach to fiscal sustainability, recognizing that if you put something like rent on the federal fisc, anything that grows faster than the economy as a whole will be the thing that drives fiscal unsustainability in the long run. Recognizing that, we need better budget processes and better budget rules, fiscal rules that recognize and take into account this sort of asymmetry between when costs are rising and when we make the decision to socialize them. In economics, they have this term called time inconsistency, which sort of goes to this idea that we're going to cut taxes today and then we're going to pay for it by cutting spending tomorrow. Well, tomorrow never actually comes, right? Because there's this gap between when you give out the goodies and when you actually have to take your medicine. Better structure, better budget rules, moving away from pure gimmicks, whether it's the debt limit or even PAYGO rules, which can have some value, but often end up tying particular pay-fors to particular items and goods, even if the pay-fors end up becoming insufficient outside that budget window. We need to move beyond to a better set of budget rules, something akin to what our colleague Ed Dolan has outlined in a related paper called Better Fiscal Rules, where he walks through how countries like Sweden and Chile, which have much better, Sweden by no means has a small welfare state. It's probably the poster child for a big welfare state, but much better budget rules that keep them in balance across generations. And part of that is key to shifting focus to cost disease, because if adding, if doing some counter-cyclical spending in a recession is counted differently than moving rental markets onto the public sector, then lawmakers will be driven to focus, to care less, to be less deficit hawkish when it comes to economic stimulus in a crisis, and more hawkish about proposals which would threaten long-term sustainability.
Yeah, and the thing, I guess, when I think about this as a political scientist, and I should say all the way in the beginning, I'm also a political scientist at the Johns Hopkins University, is this is likely to be a much more decentralized political process than old school deficit politics, right? Again, in old school deficit politics, right, you had a budget committee and they wrote budgets that then, would try and cram down changes, right? And it all happened in a very centralized way. The things we're describing are happening all over the place, right? They're happening in every university. They're happening in every city. And there are some centralized levers out there that you can pull. But in fact, I think the politics of all this is likely to happen in a very large number of jurisdictions, right? And that one thing that means is, right, it's harder in the sense there isn't just one gigantic lever that if you can just grab it and pull it, then you'll change everything, right? But it also means there's lots of opportunities for strange bedfellow opportunistic coalitions. They don't need to be the same across these various different dimensions, because each of these individual industries has a somewhat different kind of politics, right? Often the opportunities will happen because there's some embarrassing situation that makes that particular industry look bad and therefore makes it vulnerable to change, right? Some of these will happen because, as we've seen in housing, you recently get this whole sort of YIMBY movement that changes a lot of the underlying dynamics of it. And I would also say, right, in some of these areas, because some of these are ones where you do have this phenomenon of concentrated groups organized around protecting their own regulatory kind of deal and very diffuse payers, you really do need some form of subsidized political activism in order to bring the interests of those larger consumers into the political process. And at its best, that's what philanthropy does, right? It finds ways to help subsidize that organization, either through think tanks like the Niskanen Center. This is where I'm supposed to be. There's like a button to push to donate to the Niskanen Center, right? Or social movements or organizations or interest groups or litigating groups, right? All of that kind of stuff to bring the interests of the consumers in these cost disease sectors more durably into the political process is all valuable ways to try and get something started, right? And so the advantage here is, anything you're going to do is only going to get at part of the problem, but you can start in lots of different places and not just one big, very hard to grab at lever.
Yeah, and to add to that, given the decentralized nature of a lot of these policy changes that will need policy solutions, I think the first rule of thumb is do no harm. If we did pass a massive renters tax credit, I think one of the first order effects would be to take the wind out of the IMBY movement, because suddenly you wouldn't have housing costs being that pressing of a near-term issue, at least for many of the residents of those big expensive cities. So in some ways we want costs to actually bind, while creating pathways for that binding cost to drive political change in a healthier direction rather than the expedient direction. And so part of that requires fiscal conservatives, broadly defined, to shift their focus away from pure budgetary gimmicks and just worrying about the debt per se, to understanding that there's qualitative differences between, say, increasing the child tax credit or doing a massive subsidy for the childcare sector, even if they're the exact same dollar amount. If the CBO score says there's the same cost, the latter will be more entrenched and drive more fiscal unsustainability in the long term. So being more delineating a little bit better and knowing what to target and where to stand up to our history yelling stop, but this is the bad thing because it's going to undermine all these other policy solutions is really important. I'll just give one quick example, Steve. A few years ago I worked on backing up. There's been all this discussion about how to expand Medicare. Should we have new dental benefits, new hearing benefits? It seems like they're leaning towards the hearing benefit. A few years ago, I worked with Senator Warren and Chuck Grassley on this hearing aid reform bill, and I ended up learning a lot about how Medicare pays for hearing. First of all, Medicare doesn't cover hearing, but second of all, if you want to get a hearing aid, you have to get a prescription from an audiology board. There are 50 different audiology boards. They all have exclusive contracts with hearing aid manufacturers. At the same time, there's been this explosion of, personal audio devices. I mean, we're living through a consumer technological renaissance, but only a subset of those are actually called hearing aids. And so we worked on a reform that ended up, pushing the FDA to create an over-the-counter category for these new innovative models of hearing aids. So you could just bypass the hearing doctor and just go buy something that was pretty technologically advanced over the counter. And it turns out that the formal hearing aids are like $3,000, whereas you can buy something basically just as good for like $100, right? And so, if you want to have a hearing aid entitlement, more power to you. But if you also do the supply side reforms at the same time, like going after audiology boards, it will both make that entitlement more affordable, but also maybe take the air out of the demand for the entitlement in the first place.
Yeah, and the thing I was going to just mention is that, and again, thinking about the stake that the left has in this framing, right? That the socialism part of cost disease socialism might be thought of as in a way kind of de-radicalizing, right? It takes off the pressure onto the original source of the problem, right? Which is the supply side, right? It makes people, in some sense, less angry at the underlying problem of not having enough housing, right? Which is the real problem, the thing, or the problem of having constrained supply of doctors, or the ability of doctors to, to control the entire structure of the medical profession, right? That's where the political pressure ought to be directed. That's the place where people's anger should be directed. But by sort of creating this pressure release by at least, and again, it's always only temporary, right? Because when you subsidize the price, you end up pushing up the cost, right? So it doesn't actually solve the problem, but in the short term, it's a pressure release off of the anger people have where it should be directed. And so in one way to think about this is, what you want to do is make sure that the political pressure goes at the right place, right? And the anger and the organization, which is very important. And this is something that often people on the left get right, and some of us moderate centrists get wrong, because we're always looking for technocratic solutions, right? But as Johnny Rotten said, anger is an energy, right? And you want that energy to be focused where it should be politically.
I think another big structural solution, because these problems are distributed across so many jurisdictions, both public and private, that there's no silver bullet, but one sort of structural fix that is worth looking at is having some cycle, or rather some feature of the laws and regulations which we have that require some type of review. Now, there's, every once in a while, you'll see sunset laws introduced in Congress or the state legislatures, and not unlike balanced budget amendments, there's a right way to do it, and they just go a little bit too hardcore. A kernel of a good idea that's taken to the 11th power. But you can have rules where institutions that are, suspects, let's say, if we're talking about the crime of regulatory capture, are put on the defensive and forced to, are forced to be put on the offensive and have to justify. Because right now we're arguing for significant changes to the status quo, which necessarily puts these these actors on the defensive, and tie goes to the defender. We've all played risks, but when you create systems like what you have in some states, as it relates to their licensing boards, where every 5 years, in order to renew the licensing board, the license itself, the every institution from the locksmiths board to the state medical board has to go forward and say, here's why you need us, but here are in mind some less restrictive alternatives to the status quo. So again, it doesn't have to be something that is particularly extreme. It can be, we're going to look at this and say broadly, yes, we need medical licensing. We cannot return to the days of literal snake oil salesmen. However, perhaps we can tweak the education requirements a little bit. Maybe, we can allow out-of-state physicians. Perhaps we should expand the nurse practitioner scope of practice. So having some process of regular review where the rules must be actively justified is also worthwhile. The dose picks the poison in these things, but it's something worth keeping in mind.
Daniel, it sounds like you're advocating for pragmatic incrementalism, which I appreciate. I think that's more attainable than the kind of broad sweeping reform, or the idea that we can somehow hit the light switch and all of this is easily rectified. So thank you for indulging me and allowing me to take now 53 minutes of the webinar to ask my own questions and to have our panelists unpack some of the great aspects of this paper. But we have 2 questions from Bob Jones, and I want to make sure that we get to them before our time is up. So the first question is, and I'm just going to read this to the panelists in case they can't see it, so the other attendees can hear it. If you subsidize demand and constrain supply, prices go up. That's Econ 101. So how do we get Congress bought in and seeing these problems? And I think, Steve, you're the political scientist, so I think you're going to start this one.
Yeah, I mean, again, I think some of this is about, as we talked about, Sam talked earlier about changing budget processes. That's all fine, right? One is, of course, we do have a lot of congressional infrastructure that's focused around spending control, right? If you think about all of the institutional state building stuff we've done over the last 50 years, right? Whether it's CBO or OMB, OMB does have a regulatory, it has OIRA, which actually is a very interesting and important actor in this and could be even more important in this process, right? But so much of our thought and institutional design has been around financial control, right? And that goes all the way back in a way to the beginning of the 20th century, right? When, as we first started creating a modern state, right? We kept trying to figure out, how do we actually get some control over how Congress is spending, right? We didn't used to have even a centralized budgetary process, right? Congress has passed bills, and that sent direct, that ordered the Treasury Department to write checks to people, and stuff happened, right? We really don't have the same density of institutional evaluation, right? Of even training people and all these other things in the kinds of problems we're talking about now. So one way to think about the problem is within Congress, we need to really do state building, right? And again, one way to think about that, and this goes back to a paper I wrote way back when with Lee Drutman at our sister foundation, should I call them that, at New America. Congress, especially in these areas, and the same thing is true of state legislatures, is incredibly under-resourced to evaluate these problems, right? And that's true whether it's housing or zoning, or in this case Congress, right? Certainly intellectual property, right? That is one of the reasons why Dan Takash is busy, right? Is that people on the Hill need someone to very slowly explain to them what the hell our intellectual property regime is all about, right? That is a kind of failure, right? That Congress doesn't have that internal capacity. So I think one way to think of it is not just Congress, but state legislatures. We really do need to invest more in the internal capacity of legislatures to understand these problems, right? Which in a way would also make them less risk averse. One of the reasons why, and so often these organized concentrated interests win, is that those concentrated organized interests can go to often very junior staffers and say, oh no, if you do this, it'll be a disaster, right? If you do this, it'll destroy the dental industry, it'll destroy higher education, right? And they're not sufficiently trained or experienced to know whether that's true, right? And so if we built in more of this internal capacity, if we built more of a long-term career path in Congress, in state legislatures, right? So people didn't have to just jump over and become lobbyists or other things, then I think the willingness of legislatures to be more aggressive, to be more experimental, to be more innovative in all these different areas we're talking about would expand. So I think that's sort of, as a political scientist, how I think about how we might reorganize Congress. But again, not just Congress, but because some of these are state legislature and even down to city council kind of problems.
Steve, that pitch almost makes me want to go back to working on the Hill, which is impressive because it was a hard job. It's a very hard job. So final question before we run out of time. On housing, if a community doesn't want higher density housing, would they be allowed to set zoning laws to accommodate? And I think Dan was talking mostly about housing, but happy to have any of you answer.
So under the status quo, to a certain degree, yes. And that's Yeah, so it's a mess. And as far as zoning goes, the state legislature, or even potentially citywide, but the state legislature would be ideal, because in many cases, it's, there's NIMBY, which is not in my backyard, and then there's bananas build absolutely nothing anywhere. Or I think I messed up the acronym, but anyway, so, and there's mostly a NIMBY problem because a lot of housing construction is just a collective action problem. I live down the street from an apartment that was being constructed. It wasn't the best, but I understand, like I did my civic duty and dealt with 6 a.m. Construction noises. And so when you make zoning laws centered primarily at the state level, where you have by right development with a certain distance of a metro stop or something like that, you prevent the community you prevent the type of community input that creates the collective action problem where absolutely nothing needs to be built. And to a certain degree, the lights went off in the room I'm in, so I'll end on a spooky note, or at least a dour note. To a certain degree, one thing we need in legislatures, we can talk about state, congressional capacity and changing the structures and incentives and everything like that. But we need folks who are, to return to a previous metaphor, willing to jump on the barbed wire and just say no to an entrenched interest, potentially have a couple of rough primaries or re-election cycles. So at the end of the day, character counts, political courage counts, and maybe they survive. Maybe they don't, hopefully they do, but there is at the end of the day an agency issue as important as structural reform is.
Yeah, and if I could jump in real quick, just to Bob Jones, add one more question. How can we get Congress to test new policies on small sample sizes or small samples before imposing them on all of society? To Steve's point, I don't think Congress is equipped to be that nimble. We seem to take one bite of the apple every year or two. However, I do think across these different issue areas, take healthcare. I think it was a good move to create the Center on Medicaid Services, CMS's Innovation Center, right, where they can pilot ideas that in principle are supposed to improve healthcare access and lower costs. And if they do work on a small scale, to iterate and then scale them up nationwide. They've done that in a few cases. A lot of the stuff that was recently reformed in our kidney dialysis programs within Medicare for end-stage renal diseases came out of those experimentations. There's been similar experiments done for treating diabetes through YMCA meeting groups and so forth that were tested in those pilot programs and then scaled up. So a lot of our agencies could really benefit from having dedicated skunk works that were always trying things out, and if they had met certain criteria, to be able to broaden them. But bigger picture, if we really want to get Congress to see this, we also have to get the upstream people influencing Congress to understand this as well. And our work has been addressed to the right, talking, obviously we have socialism in the name of our paper, but it's been heartening to see how folks like Ezra Klein have also picked up the torch and said, the left needs to focus with the supply side too. We need a supply side progressivism. So I think we're seeing hints of a new consensus forming where hopefully left and right can they'll have different priorities, but see the importance of the supply side, the genuine supply side, not just top marginal tax rates or something like that, and try to find areas where they can work together.
Well, thank you so much for this conversation today. I find that one of my favorite aspects of being involved in conversations like this is that I always learn something new. I had no idea about the kind of hearing aid system and that how hard it would be to get a hearing aid. So I hope that our attendees appreciated the conversation as much as I did, and that you learned something new or come away with a different perspective. And all of our panelists reference papers by their fellow Niskanen scholars, which you can find on niskanencenter.org. We encourage you to do so. Thank you so much for spending your afternoon with us. Have a great day.